So welcome everyone and thank you for joining us. We'll be recording today's session. You'll also receive a follow-up email with a link to the recording and the PowerPoint slides a couple of days after the webinar. We'll be sending you a link to a brief survey after the webinar as well, and at the end of the survey you'll be able to download a certificate of attendance. The webinar will start shortly. In the meantime, please enter your location, city, state, include the country if you're outside the US, into the chat box that's at the bottom of your screen. So we can get an idea of where our attendees are joining us from. So I am just letting folks in, and we'll probably give it another minute until it starts to slow down, and then we will get started. Thank you. Thank you everyone for putting your location in. So I'm going to go ahead and ask everyone to mute. We will have some time during the breakout sessions when you can unmute and talk in the small group discussions. But I'll just to kind of keep things a little quieter for the whole group, I'll go ahead and mute people. Thank you. You can always unmute yourself as needed to jump in. And we do have the chat box that you can enter questions in. All right, we're a couple minutes after the hour, so why don't we go ahead and get started. So welcome to today's webinar, Choosing Wisely, Practical, Effective Tools to Select and Implement New EBPs, which is presented by the Child and Family Evidence-Based Consortium. This webinar is hosted by the California Evidence-Based Clearinghouse for Child Welfare, commonly known as the CEBC. My name is Jennifer Rolls-Roots, and I'm the director of the CEBC as well as a member of the consortium. Before I introduce our presenters, I'd like to review a couple of logistics for today's meeting. So we can advance to the next slide. You probably all know this from all the Zoom meetings you've been doing over the past few months. But as a reminder, the audio control for the sound for your speakers and eventually for your microphones for the breakout rooms are at the bottom left-hand side of the Zoom screen. We are muting attendees. Please keep muted unless you're speaking, but you can still test your audio and get an idea of what things sound like. If you have questions for the presenter or for the CEBC, please go ahead and submit them in the chat pod during the meeting. We will be saving presenter questions for the end. We will have time at the end for some question and answer. The webinar is being recorded and will be archived on the CEBC website for anyone to view in the next few days, along with a copy of the PowerPoint slides and the relevant handouts. You'll receive an email when the recording is posted. Please note that the breakout room discussions are not being recorded. Lastly, at the end of the webinar, you will get a link to a brief feedback survey so that we can improve the webinars, make them useful and relevant. And as part of that survey, you'll be able to download a certificate of completion. The CEBC is funded by the California Department of Social Services, Office of Child Abuse Prevention, and is operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego, California. And now I'd like to introduce our main presenters from the Child and Family Evidence-Based Practice Consortium. So Rosalind Bertram, PhD, directs the Child and Family Evidence-Based Practice Consortium in its many projects and publications. With the other consortium participants, Dr. Bertram studied the extent to which evidence-based practice is taught in North American MSW curricula and produced a series of national webinars addressing those findings. Jackie Brown is an international implementation consultant and executive director of Families Foundation and exiting co-director for the Child and Family Evidence-Based Practice Consortium. Other details here, as you can see. So I'm going to keep this moving. And now I believe I'm turning the webinar over to Rosalind.
Welcome, everyone. So glad that you're joining us for this second in a two-part series, taking a look at tools that we've developed to support organizations as well as state systems in thinking through selection of programs, some of which may meet FFPSA requirements, but these tools also are applicable for thinking through and carefully selecting any program for any organization. Today we're going to take a look at a second tool. We're going to show you both of them in a moment. That builds from the information gathered from the first. Jackie's going to be walking us through an example of how to use that second table tool. We call the first one our tips tool, which are prompts of things to think about, data to collect. And then that data and information is organized in discussions and placed in the table tool that Jackie's going to walk us through today. And I think right after that, we will go into breakout rooms and talk about how we can individually in your own organizations use these tools and whether or not you want to work with us in any way around doing that. So Dan Edwards is all from Evidence-Based Associates is also going to be helping us with this, and George Tripp Akey from Duke is facilitating the movement of these slides, which let's go to the next one, Tripp. So just very briefly, this is from our website, ebpconsortium.com. It gives you a brief introduction of what our intent is. The consortium's been around since 2004. Leadership changes over time as ideas, concerns, various focuses emerge in the field of child and family services and in implementation science. Next slide, please. This is our current set of leadership, and if you can see my cursor, I'm going to walk across. These are the folks who are going to be facilitating the breakout rooms today. Myself, Tripp, Jackie, Sue, Cricket, Jennifer, and Jesse, and Dan. So that's who you'll be joining with in one of the breakout rooms. Next, please. Next slide, please. Yeah. These are some of our emeritus participants. David Bernstein, Patrick Cannery were some of the original folks, with Bianca Albers, who's now down in Australia, Jane Lewis from England, Lynn Marcinich, who did wonderful work in California, and Jen Metrick from the University of Maryland. Next slide, please. This is just a quick glance at some of our more recent publications. We've been facilitating a number of special issues looking at either workforce development, the Journal of Social Work Education specific to EBP and implementation science, or putting together packages of presentations that we invite to our track of the Research Policy Conference for Child, Youth, and Young Adult Behavioral Health that occurs in Tampa, currently on hiatus due to pandemic. You'll find a lot of resources like this on our website. Next slide, please. So that's the address, and we encourage you to come look at the many things that are there. The tools that are being introduced in these two webinars are available on separate web pages, I should say. The second tool that we're working with today should go up sometime later this week on the website. And I think I turn it over to Dan here. Yes? Next slide.
Sounds right.
Yep.
Good afternoon, everybody on the East Coast and Central region, I guess, right? And then good morning to everybody else. Did we skip one trip? Did we go back one?
Nope.
Nope. Okay. All right. Last webinar, we talked a bit about the FFPSA. In fact, we talked about it in depth, maybe too much depth, but we covered the purpose, the background, introduced some folks to the clearinghouse, talked about the levels of evidence and so on. So if you're interested in a review of FFPSA, then you can go back and listen to the first webinar. I think the link was included in the announcement for this webinar. Next slide, please. Yeah, there we go. That's the slide I was looking for. So there's your FFPSA overview real quick. The fact that it covers evidence-based and trauma-informed prevention programs. There's the website for the Title IV prevention clearinghouse, and the 3 levels of evidence that we talked about last time. Okay, next slide. All right, so today we'll get to the actual application of the implementation tip sheet and the tips tool. But last time we covered the purpose and some of the background for the tools to promote careful selection of evidence-based programs. which involve a few steps. And so at the beginning, we talked about, or we introduced folks last time to the idea of identifying the candidacy group as an important first step, which families we intend to serve, the data that we have on the children and families who are the target of this program or service, and to inform decision making, and to go through a process of establishing the priority need and service areas. We'll be covering some of that again in the breakout groups today, and facilitators will have both the tip sheet and the table today to sort of crosswalk those and show you how we intend for them to be used. We also covered some of the steps involved, recommendations around the systematic selection of evidence-based programs and services, how to ensure alignment between the candidacy group, the risk and protective factors that are identified, and the appropriate evidence-based program. Other factors to consider, potential partners that should be involved in the conversation, and some of the funding considerations, not just FFPSA, but other funding strategies. Next slide. So this is what we presented last week, or an introduction anyway. As I just talked about, the identification of the candidacy group and the systematic selection process. So I think at this point, to dive in a little bit deeper, I'm handing it off to Jackie.
Sorry, my apologies, slow it taking off my mute there. Thanks, Dan. Yes, so what we're going to introduce today is a planning template that has been developed to support the use of the tip sheet and to support the choice of the right evidence-based program for the organization that is going to deliver the program. So it's a two-part tip sheet, the two-part planning template, my apologies. It's part one asks the organization to establish its requirements. And there are various considerations that are prompting the organization to think about so that they can establish and articulate the requirements they have. Then part two is a process of assessing the program in consideration of the expectation and requirements that you've set up. So if we could go to the next slide, I'll walk you through an overview of the planning template, and then we'll dive into a little bit more detail. So as you can see, the template reflects the characteristics and the considerations that are noted in the tip sheet. So you need to think about who's the target population, your candidacy group. What are your identified outcomes? Consideration about what are your expectations of the staff that are going to deliver the program. What are the modalities, the formats that you want to deliver it in? How are you going to support those staff through coaching, supervision? What kind of formats, what kind of frequencies are you going to use to support the people delivering the program? What are the data requirements that will be needed in terms of you monitoring and evaluating the effectiveness of delivering the program and the fidelity of delivering the program? You need to think about the language and culture in which you want to deliver the program. In today's multicultural society, that's unlikely to be exclusively English. So there may be different languages and cultures you need to consider when considering a program. And then finally, you need to think about the costs. The costs not only to install the program, the startup of the program, but then the cost for sustainability. So that's the overall way in which we ask you to consider establishing your requirements as an organization for any program that you're implementing. And we'll go into a bit more detail with an example. So trip the next. So this organization is currently considering a parenting program. If you'll note at this point, it doesn't identify which parenting program, but it's identifying its considerations, its requirements for a parenting program. So as their target population, their candidacy group, they've talked about and they've identified that they want to address and provide for parents and caregivers who are at risk or are maltreating their children. So that's their target group. What do they want to achieve by delivering the program? They want to eliminate harsh parenting practices, they want to reduce out-of-home placement, and they want to increase the use of positive parenting practices. So they're reducing things, they're also providing for an alternative and a positive impact. The data requirements, they want to look at each session and how that's assessed, and they need some data to evaluate that. They want to look at what is the outcome for the parent, and they've articulated what that might be. And they also want to look at program outcome measurement. So they've identified 3 different areas in which they want to look at data, and so can explore how they can plan for that. They've identified they want to be delivering in Spanish, Arabic, and English. And so those are the languages that need to be able to be accommodated by whichever program they choose. Next slide, please, Trip. Thank you. In terms of, staffing expectations, they're clear about who the staff are, what is the workforce they want. They want licensed social workers who can do assessments and provide both group and individual interventions. So we're talking about a fairly significant clinical intervention here, and the licensed and qualified experienced workers, professionals to provide for that. How do they want to deliver? They want to be able to deliver in-home, individually, in offices, individually. They want to deliver groups, but they also want to do an online delivery. Particularly pertinent, you have to have those accommodations in our current circumstances. What they anticipate doing is providing monthly individual supervision to the workers. That's how they are accommodating, or how they're anticipating supporting people. And they have not a lot of information yet about the costs. So they haven't got as far as figuring out what are the costs going to be for startup and what are the costs going to be for sustainability. Next slide, please, Trip. So what you end up with is an overall picture of what the organization's expectations and requirements are to meet the needs of the parent, of providing the parenting program that for the target population they've identified. And it's a very quick summary. This is not a deep planning process, but it enables you to articulate things as an organization, share that information so it's consistently available across the organization at each level of the organization. And then it enables you, having established your requirements, to start looking at programs and assessing them in consideration of these requirements, which takes us to part 2 of the tool, the template. So part 2 is how you assess the fit of the program, so whatever program is being considered, to the requirements your organization has established. And you might actually assess a number of programs because there are often a number of evidence-based programs that will actually meet the needs you've identified and achieve the outcomes that you want. And through that process of assessing, you can start to establish which is going to be the best fit and where you might need to make changes to actually implement that program and sustain it. So again, we use the same categories of exploration and consideration. My apologies. And we're suggesting you use this scale of, does it currently fit? As is, does this program accommodate the requirements we've already set? Or does it require change to actually implement this program, but we can accommodate that change as an organization? Or is it actually not a fit, and any change required to make it fit, we could not accommodate? So it's a simple assessment scale in terms of a first cut at what might fit. And then the tool asks you to put a rationale, so that when you're sharing this with information beyond the exploration that you're doing, other people can understand why you've drawn those conclusions, or perhaps you can look at what you want to explore further. And so you do that process for each of those topic areas, target population, outcomes, staffing expectations, as was noted in the requirements. So let's drill down that one a little bit. Next slide, please. So the program being considered here is the parenting program they've decided, this organization has decided to consider, is PPP level 4 and 5 pathways. So 2 of the PPP suite of parenting programs. And when they look at the target population, the evidence indicates that PPP levels 4 and 5 are evidence for this population, so it is a current fit. And then looking at the outcomes, again, PPP has been evidence that the outcomes are consistent with what the requirements of the organization have identified. So again, it's a fit. The data requirements, there is both a fit and some change that would be required. So PPP International has session checklists and a data collection software that can be used for these programs, but there's no clarity as to whether it will easily interface with the operating system. So there might be some required changes there that would have to be explored. Language and culture, it's a fit. The programs can be delivered in those languages, though perhaps Pathways has not yet been evaluated to be delivered in Arabic, so could that will have to be explored a little further. Next slide, please. Oh, you've already gone there, thank you. So then we look at the staffing expectations, and again, there's a good fit for the staffing workforce that was identified. But it may be that some changes will have to be created in terms of how they deliver the practice. You know, are they good at promoting self-regulation versus directive care, that kind of thing. Service modalities, there's a current fit, except for there is no Pathways online program. So PPP 4 and 5 can be delivered, so that fits, but there's no Pathways online and probably not going to be. Coaching supervision, it would require change. As we noted, the requirements that were suggested by the organization would that they would offer individual supervision monthly. PPP programs require monthly peer network support. So there would perhaps need to be an accommodation that could be made for the type of peer support and networking and coaching that the evidence-based program requires. And in terms of the costs, as we noted, they hadn't assessed them. They needed more information. So that's noted on the assessment. And there is a note that for PPP, the sustainability costs for families are pretty low. And so that can be considered. So that gives you, and if we move to the next slide. So then you end up with an overall assessment against the identified requirements that the organization has identified of whether this program is a good fit or not. And if you do that with several programs, you can see you would start to develop an understanding of whether the program of the choices you have is the best fit and how easy it would be to accommodate it. So that provides you with a very brief overview of each of the 2 parts of the template, of the planning template, how you might use it. And so what we're going to suggest is that in the breakout rooms, we can answer questions and you can explore a little further how this tool, the tip sheet and the planning template, might be of use to you in considering evidence-based programs, not only for Families First, but for other implementations that you might want to embark on. So I think I'm going to pass it over to Jennifer to open up the breakout rooms.
Trip, if you go to the next slide, we're going to go ahead and open the breakout rooms. I think I have most people assigned, but I may need to kind of move some folks around if I missed you, so just hold on. I'll launch those in a minute. The breakout rooms are not being recorded, and we will return back to the full group at the end to do some questions. So I'm going to go ahead and open the rooms. You all should move automatically, but like I said, if there's any issues, I'll slide you over. Thank you. I hope the breakout discussions went well. And we'll just give everyone a second to get back in. And I think everyone is back in the main room. And I think, Trip, you're going to share your screen again. And I think, Roslyn, are you wrapping us up today? And Roslyn, you're on mute. Let me.
I was just
There we
posting.
go.
I was just about to post it there. Dee Dee, you just gave me your email. I was posting my
Okay.
email to my
Oh,
group
excellent.
that reach me. So don't run away, guys. Don't shut it down before I can get it up. So what we've presented, and it would actually be good if, do we have enough time? We've got like 15 minutes. Do we have some time to hear back from some of the groups?
Yeah, I think we do. People can always unmute themselves, or if the facilitators want to share, just go ahead and mute yourself. Roslyn, if you want to call on people, go ahead.
Well, let's do it with the facilitators. And real quickly, I'll start off. I had a very nice, tight little group, representatives from Kentucky with systems of care grants, and of course, a rich history of engaging community and multiple providers, but they're now focusing their new grants on child welfare. We also had folks who are looking at residential type placements in Florida, and that was James. And there were some questions there that we were just getting into about selection processes, and I guess a sense that Florida's rushing it a bit from his perspective. And then Glenda, who's identified MST and PLL, Parenting with Love and Limits, who's doing work with NAPI in New York. So we had an interesting mix of engagement around FFPSA and the larger questions that can be worked with these tools. Other facilitators. Jump right in, Cricket. Or Sue, whoever's ready.
Sorry, it took me a minute to get unmuted. Thanks, Roslyn. We had a small discussion group. We did sort of open it up for some broader questions or discussion. And one of the things that we spent a bit of time talking about is how to truly ensure that everyone is involved in the decision process, and that community stakeholder group really has the representation that it needs, and that everyone has an equal voice in that. And sort of how does one avoid those who have a position of perceived authority or power, from sort of preventing them from dominating the conversation. So there was a request for the consortium to assist agencies with those kinds of discussions. With regard to the tool, one of the things that we focused on was the data requirements section. And it's interesting, our discussion, we had someone who works for a developer of an EBP and someone who runs as a manager of a county research agency. And so we talked about some of the challenges that could exist for a provider organization who might have to meet data requirements for, say, a portal for an evidence-based practice, as well as submission for a county or state system. And to perhaps flesh that out a bit more in our tip sheet and tool to be more explicit about some of those challenges that folks might encounter and how they would address those.
Sue?
Yeah, I would say that we echoed some of those similar thoughts just about, who fills this out, how to have it be a collaborative effort. My team, please jump in if I misrepresent anything. We kind of spend a bit of time talking about complex implementation initiatives and how this tool could, be helpful. We saw the example of it being a pretty discrete program that you could walk through and understand, but some systems are really grappling with, a lot of complex needs and talking about how this tool could be used or might need to be adjusted accordingly. We ended our time together with a question that we didn't really get a chance to digest too much, but just thinking about COVID right now, and how programs might need, and actually this relates to actually the beginning part of our conversation too, about how in part two, when you're assessing the fit, how flexible are different EBPs and not, and what can change. And during this time, how do you get information about what EBPs are doing to be flexible around this time, and some of the challenges associated with that is kind of a neat thing to be thinking about as well. What am I missing, y'all?
Pretty thorough.
Yeah. All right. I'll put it on to the next group. Okay. I got a thumbs up from Zach. All right.
We had a great group of public and private and technical assistance providers. And what I thought was really great is that each one kind of was able to think about using the tool from where they sat. So for example, someone more in a, potential role of like funding as a public agency was able to think about setting expectations for contracting, and then actually using the second part of the tool to assess whether responses to contracts met those expectations. So I thought that was a really cool creative use. As an agency, or private agency, being able to articulate really from the agency lens, what's the capacity that we have, to offer when we're assessing, is this a good fit? So for example, we often undercount some of the behind the scenes data collection that has to happen. So really outlining, well, what do we have in terms of data capacity, and making sure that's articulated in part one, staffing expectations, and trying to go back and kind of assess that as you look at a particular program. So those are just kind of, I think, two examples of how where you sit and really affects how you use the tool. But it seemed like it was really versatile in terms of those areas. In terms of struggle, that was a question. So where do folks struggle? So I think in child welfare, making sure we frame our outcomes positively. I thought that was a really important comment. And because we get very deficit focused, and I think that could be true for a lot of those, as well as just looking at the financing. We, really articulating all the costs up front with services.
So this is Trip. I'll try to be quick. There's so many great things that have already been shared. We had a group mainly of child welfare agency types with some health and human services and probation. A couple of the themes that came up were we're here because we're either in the midst of making a change in a program, or we're trying to kind of assess some of the strengths or concerns about a program. One of the quotes that'll stand out to me is, "I wish I had this tool about 3 months ago," when we were making some decisions or having conversations. And some things about the tool that people really liked were the extra on the end, having another domain that they could add that's specific to their group. So if it's more like what's important to the funders, or is there contractual obligation that helps or hurts related to fit, as well as the language and culture kind of piece, what's available in the languages. Like we had someone from LA that has a lot of different groups represented that maybe an English curriculum or survey or practice or curriculum may not map on as well for. And also talked about startup costs versus sustainability cost, and how many of us might have been in the position of people are all in for startup cost, but then struggle with sustainability cost, and maybe are either taken by surprise or wish that they had kind of thought through all of these pieces before jumping in.
Jackie, Dan?
Yeah, very similar comments. A really interesting discussion in our small group. I think I would reinforce all the things that have been said, particularly by Trip and Jesse in their groups. There was comments that this was the first kind of tool that people had seen like this. It was very accessible, could be used in different form to present information to different audiences, engaging different people, because it wasn't just clinical language. There was a request that perhaps there could be more guidance in thinking about those two cost brackets, that maybe some more prompt considerations, or even developing some checklists, some supports in addition to this and further to this. But I think the general impression from the group that I was working with is the accessibility of this, the usability of this was refreshing, and people commented that they will actually be looking to the website to get it and use it. So that's my augment. Other than that, the comments were much the same as everyone else's. And thank you.
Dan,
Yep, and
let's see if we can answer Zach's question. Go ahead.
I didn't hear what you asked, Rosalind, sorry.
Dan, are you going to go? Oh,
Are you going to share what happened in your group or not? You don't have to.
I was just going to very briefly, we had a very good group. Sarah from outside of Seattle was working on a SAMHSA grant in West Virginia and thought it would be very helpful to her group, but outside of FFPSA. Christine from Shasta County thought this would also be a very helpful tool as they work on their FFPSA plan and fine tuning. And then April from Santa Clara was also talking about the different EBPs they already have, but thinking about expanding and how the tool might be useful. Roz, before we go, we want to, the group did ask about how to follow up with the group, with the consortium about some consultation.
Okay, my email is down at the bottom of the chat. bertramr@umsystem.edu. That's the quickest way to get to me. There's also an email address on the website, which eventually gets to me. We're just up to our ears in alligators with COVID here right now. So direct email, bertramr@umsystem.edu. And Zach, I wanted to touch, I just saw your question. How do you eliminate the inherent bias of organizational leader assessing these criteria on their own? Did you get an answer to that in your breakout group?
We discussed it a little bit. We said that incorporating more perspectives might be one way to do that, but I don't think we came to an answer, like a tangible or actionable really answer.
In a short amount of time, it's very difficult. That may be the sort of thing that if we worked with you as consultant or TA, we might be able to help work around that. Sometimes that's what helps, is bringing in quote unquote an outside expert or something. But it really, a whole lot depends on the nature of the beast, so to speak. No aspersions, just using vernacular. I think we have just enough to run our polls, but before we do, I want to emphasize again, we're opening up to work with 2 or 3 groups or sites or whatever the size is that's interested in engaging with us around the use of these tools. It will help us refine the tools and see them actually being used. It's one thing to think about it, one thing to present it, and then one thing to actually use it. So please be aware, if you're interested in that, send me an email and we'll start talking. Shall we do the polls?
sure. Let me go ahead and launch the polling. So our question is going to be about what ways you think this set of tools, the tip sheet and the table, are useful to you and your team. Could be not at all useful, and if you feel that way, we'd love to get your feedback on what we can do to improve. Same thing with the somewhat useful with revisions, comments, or you can email us. Useful for targeted or narrow applications, specific sections, could be used broadly as part of a comprehensive planning process, or maybe useful but would also appreciate consortium support. So all of those are great answers, and again, we're refining this tool and would appreciate any feedback that you want to share with us. So I'm going to let folks vote on those options, and I've got voting coming in, so we'll give it a few more seconds. Okay, just a couple more seconds. It looks like the voting is slowing down. So I will go ahead and end the polling and share the results. So as you can see, the majority of folks were saying that could be applied broadly, and then followed by useful for narrow, target or narrow applications. We had a few folks who would be interested in consortium support. So again, Rosalind has put her email address in the chat box. Please feel free to reach out to her directly. You can also reach us through the website, ebpconsortium.com. And again, we'd appreciate any feedback. And then Trip, if you can go to the last slide. So again, we'd like to thank everyone for joining us today. You will receive an email in the next few days with a link to the webinar recording and the PowerPoint slides. You'll also be receiving a link to a brief survey on the webinar. At the end of the survey, you'll be able to download a certificate of attendance if you need that. And unless there's any comments or last words for any of the presenters, we'd like to thank you and have a great rest of your day.
Quick last word, this will also be available on the website, the consortium website, ebpconsortium.com. Yeah.
Great. Thank you, everyone.
Thank you.